There's a lot of fluoride products on the market. For many years, I have used Profluorid by Voco because it has the highest amounts of fluoride released within the initial 2 hours of application. And for me, that's critical for my patients that have meth mouth, because I want to get that fluoride into their enamel as quickly as possible so that I am reversing the demineralization and promoting remineralization. I'm able to desensitize their teeth fairly quickly so they can become more tolerant of hot and to cold. And I'm also able to slow down the progression of decay because I'm using fluoride varnishes to buy me time as I'm doing caries management. But I also really like Profluorid because it is a clear varnish. And my patients who have meth mouth, their teeth are blackened, and they are opposed to me putting anything on their teeth that's going to cause any further discoloration. So I've got a lot of patient acceptance with this clear fluoride varnish. So I want you to really think through your strategies when you are dealing with a patient that has a lot of caries due to their drug use, that you make sure you have a fluoride varnish in your toolbox. Another strategy that's been really helpful for me is using direct restorations. And we have to have a dose of reality. You know, even though we've had conversations with our patients about their substance use and we've educated them, the reality is that their substance use is not going to change overnight, and all the other competing factors such as sweetened diets and poor oral hygiene are not going to change necessarily overnight. So knowing that, I want to have direct clinical and visible access to my restorative margins, and direct restorations allow me to do that. I also like direct restorations because I can do many direct restorations in one visit, whereas it would take me more time to do an indirect restoration. So the time it takes me to do one indirect restoration, I could have done 3 to 4 to 5 direct restorations. So it's very efficient, especially as I'm trying to do caries management. They're also less expensive, obviously, and requires fewer visits. A material that I've been using that's been very effective, I've been using glass ionomer for 20 years, is thinking about the importance of using a material that's going to assist you with all the things that are problematic: demineralization, thermal sensitivity, and this caries rate that we see in the patients that are using drugs. And so glass ionomer is a great material because it's releasing fluoride throughout the duration of the restoration. So I'm promoting remineralization. I have margins now that are fairly caries resistant. And I use glass ionomers for interim restorations, but this is a material that's also really versatile. I can use it as an interim restoration. I can use it as a permanent restoration in non-loading surfaces. And I can also cut the glass ionomer back and do a composite overlay. So it has a lot of versatility. Once again, there's a lot of glass ionomers on the product, but there's really a lot of materials now that are kind of like the next generation of glass ionomers. And Voco makes a great product, which is IonoStar, which really is a beautiful glass ionomer. It achieves all the things that we want, plus it has excellent aesthetics and is very luminescent.